Great. Thank you so much, Kate. I want to introduce Rochelle Poulain, who is Associate Producer and Public Engagement Director for the Raising of America, Linking Early Childhood to the Future of Our Nation, which is a forthcoming documentary series and public education campaign produced by California Newsreel. She's also was Associate Producer and Director of Outreach for, as you know, the award-winning documentary series Unnatural Causes Is Inequality Making Us Sick? She also teaches cinema at San Francisco State University and engages her students in interesting ways about communicating health information. So please join me in welcoming Rochelle Poulain.
Thank you so much. It's an honor to be here and to get to share this time with you. So here I get to share the other side. We went from television and now we're going to go, well, to PBS, that's still television, but documentary film. So we call it documentary film, but of course it's not just holding up a lens to the world and saying, we just see what we see. Rather, it is still creating a story, taking the information, shaping it, and being very conscious of how we blend the research with the storytelling in order to do what we hope is make documentaries that move the heart and move us to action. So really here today I want to share a little bit with you about our thinking in how do we use documentary to create a more just, a more equitable, and a healthier society. I'll share a little bit about Unnatural Causes. I know that many of you here are familiar with the series, but also talk about The Raising of America, which is currently in production and which has been, when it comes to communication and messaging, giving us a very healthy set of challenges in how do we communicate. And so we are far over our timeline and budget because we have found in test audiences that we've triggered exactly the messages and the feelings that we don't want to. So I'll talk a little bit more about that. And I welcome any feedback and ideas because we really are struggling in how to talk about these issues. So we're California Newsreel, and what we do is both produce and distribute documentary films. And the films in the series that we produce are always tied in a larger public engagement campaign, and I'll talk more about that. For us, and this is a quote from Larry Edelman, who is the series creator, our executive producer, I call him our fearless leader at California Newsreel, that really when we look at a documentary film, the way that we measure success is by looking at how effectively it can be used by those organizations who are already in the field, who are working to advance health equity, who are working to create a more just and equitable world. So how can our series really be tools that help support that kind of work? That's how we measure success. Unnatural Causes are a quick reminder, if you're not familiar, and a quick introduction if you're not familiar with the series. It was released in 2008, both on video and also for a national PBS broadcast. And the series was organized in 7 parts, which I'll go through in just a moment. But really, the whole point of the series was to look at how health tracks long lines of race and class, and to really show the gradient to health as is experienced in the United States. And so we created this documentary series in the context of a national public engagement campaign. And here the idea was, how can folks use this series as a tool to really reframe the debate around what we as a society can and should do to really advance health equity. So to support this public engagement campaign, we also created a companion website that had tools, discussion guides, and I'll talk a little bit more about why we do that, and it comes to how do we help folks use the series to really change the conversation. So when we looked at Unnatural Causes, we came out and we said, what we really want to do here is reframe health. That health is talked about typically, and we still see this, as healthcare, your access to healthcare, your behaviors, are you eating well or not, are you exercising, and your genes. And so for us, we started off by saying, all right, well, what we want to do, how do we engage people? And it was very simple to say, it didn't come out just that simply. But when we started going through all the messaging, oh, well, we want to introduce this by saying, actually, health is more than healthcare, behaviors, and genes. To do that and to say that way, it inspires the question, well, then what is health? So let's just watch 46 seconds of the opening show. And I think that you have the control up in the booth. There we go.
There's one view of us as biological creatures, that we are determined by our genes, that what we see in our biology is somehow innately us because of who we were born to be. What that misses is that we grow up and develop. We grow up as children, we grow up as adults and continue. We interact constantly with the world in which we are engaged. That's the way in which our biology actually happens. We carry our history in our bodies. How could we not?
Thank you. So, and we had this fabulous quote of we carry our histories in our bodies, how could we not? And then we launch into the rest of the episode. And what we tried to do through the entire series was really to come back over and over to answering this question, what is health? And so as you'll see here, I've listed out the episodes, and in trying to, in the shortest way possible, to say what were we trying to accomplish with each one. So the opening episode, that's the hour-long show, In Sickness and in Wealth, here we were trying to establish there is a gradient to our health. There are the social determinants of health. And so we follow, and this is where we start to blend storytelling with facts. We can follow through different neighborhoods of saying, in this neighborhood, this is how long people live. This is their health. This is, on average, their socioeconomic status, levels of graduation from high school. And then we go, as we move through all the different neighborhoods, we can start to see that in the wealthiest, most affluent neighborhoods, life expectation is longer. And in those neighborhoods where we have folks who are living in poverty, then we start to see life expectation and health status decrease. Now, what worked about that was that people immediately, in using this sort of thread, and then filmically, everyone that we start to meets working at a hospital. And so that's the irony of, we go to a hospital, but we're not going to talk about healthcare. We're going to talk about the people who are working there and what their own health status on a population level might be. But what it did by doing this filmically is that immediately folks would watch it and say, oh, where do I live? Oh, what neighborhood what do I have? And so what that serves to do is it puts the I in watching this. And this is where we start to find, how do we connect, and we've heard a little bit about this today, this linkage between the individual and society, and that we tend to have a lot of our messages talking about society and social structures, and the person who says, well, what about me? Where do I fit? And so this was a filmic device that worked for us in being able to say, all right, here's the I care about my health and my family. Where do I fit? But very quickly you could see, oh, if I lived in that neighborhood, maybe I'd have more. Or, oh, if I live in that neighborhood, I wouldn't have the same opportunities. And so that was starting to create this bridge outside of just me, my family, and my community into seeing how it might be for others. With Place Matters, we wanted to talk about, you know what, this doesn't just happen. Good neighborhoods, bad neighborhoods just don't drop out of the sky. That actually there's a way in which we create these. And so here, by looking at the differences in two neighborhoods and also taking the opportunity to take a historical look. So in Richmond, California, we go back and we look at World War II, the end of World War II. That means that the shipyards closed down, there's a loss of jobs. What also happens that the U.S. gives, on a racially restricted basis, federal housing loans. So because those are on a racially restricted basis, it means that a certain part of the population coming back from World War II now has access to be able to own a home, while another part of the population, and we cut down along racial lines, doesn't. And so we can start to say, oh, let's look at Richmond and what happened to Richmond, California, present day. And we see that there is a community that is divested, that there's concentrated poverty, that there aren't the jobs that need, and it used to be a vibrant place. We go up north to Seattle, and there we see, all right, here's a low-income community where we want to create change. And so suddenly you can say, oh, it's possible to do something differently. We see houses being knocked down, others coming back up. We go follow a family, who's able to, her little boy has asthma, and he's now able to be in a home that actually filters the air. So again, it's wanting to use the opportunity that these are the stories, but the message behind the stories is to say things don't just happen. These are not acts of God. When the Bow Breaks really looks at how racism gets under the skin, and you'll excuse me for talking a mile a minute, but I do have a plane to catch and a little girl to see this evening, so that's why. But we talk about how racism gets under the skin, and so yes, talking about racism, you say, we're going to talk about racism, and most rooms go, And it triggers a lot. We all come with a lot around that. But the story here looks at and is centered around studies that have shown that if we compare white American women on the socioeconomic ladder, we see that the wealthier you are, usually lower rates of preterm births and infant mortality. Now, for their counterparts in African American women, we see that African American women on each step of that socioeconomic status have higher rates of preterm birth and of infant mortality. So the study said, well, what happens when we compare African women who are immigrating to the United States? And we found that African women immigrating to the United States had similar results as their white counterparts. However, their daughters, so one generation later, their daughters showed similar rates as African American women. So that is saying there is something about racism that literally gets under the skin and changes outcomes when it comes to health. We go on to bad sugar, talking about how is it that policy matters. And so here we look at the PIMA and say, all right, there were policies that were put into place that diverted water from native tribes to white landowners, native tribes that had been dependent on the water in order to grow their foods, who then became dependent on the U.S. government for food subsidies that did not introduce fresh fruits and vegetables until the early 1990s. And yet, there is so much research being done trying to look at and find the diabetes gene, because it must be in the genes, but ignoring this larger context. So here we're saying, policy matters. Policies of the past continue to affect us today, and that we can change these policies. So we go from there to saying, well, society matters. And here we look at Mexican immigrants coming to the United States and seeing that although poor, most Mexican immigrants that come to the United States have a higher health status. But the longer that they're here, and we see this after especially 7, 10, 12 years, that their health status starts to decline. So that it is this wear and tear, the relentless stress, chronic stress of not being able to meet your bills, feed your family, to feel confident in your job, to have the means, that wears away at our health. But in there, we see the protective factors of having these social supports that actually really help. So we follow a family to talk about how it is that society matters. We go on to look at globalization. So this is not just an issue here by looking at the Marshallese, where there's a very stark difference. 3 miles apart, 2 different islands. One island where there's Americans living a middle-class family on the base, and then there's overcrowding on another island where the Marshallese have been forced in high rates of tuberculosis because of the conditions in which they live. Now the U.S. says, oh, Marshallese can come and work in the United States. So we look at what that means to come and work in the United States, and while there's some bump in health status, it's still actually not enough. So saying that we're looking at the global forces here. And finally, with not just a paycheck, coming that message of it doesn't have to be this way. Now the story, Not Just a Paycheck, follows Electrolux, a refrigerator company that leaves 2 towns, one in the United States and one in Sweden. So what happens to the town in the United States? You probably know. People are not able to find jobs. People who had been living a middle class life, who are in the second half of their lives, they're not able to get training. And the hospitals start to see higher rates of depression, higher rates of heart attacks, because again of this unrelenting stress. And the town is not able to get back on its feet. Sweden, they describe it as barely a ripple. People continued to get 80% of their salary. They were able to go back to school. So we had a gentleman who says, oh, for me, it was an opportunity. I've always just wanted to do this, and I got to go back to school for it. And not only that, but Electrolux had to pay $3 million to the community to help foster new economic development and new businesses, which they did not have to do in the United States. In the United States, folks in the community got nothing. So it's looking at, and there is a whole body of conversation on if you compare the United States to European countries, will people want it or not? And some people say, I want to see that, and others don't. But I think that one of the, and our experts at Dr. Jack Shonkoff in this most recent one, in Unnatural Causes as well, says what will be the American way? And so this comes back to, in all of this, always for us, we're thinking of how do we communicate, but we ask the question, what will be the American way? So what worked? Well, we got this aha moment. And the aha moment was, like I said before, linking our personal aspirations for health and well-being to social structures. People got it. And they got it especially when you describe it on a personal level. I say to folks in the neighborhood I live in, I've got a pool, a park that are in walking distance. I've got the equivalent of the Whole Foods, perhaps not entirely your whole paycheck. I also have the Safeway. I have a corner market and a corner store, which immediately we start to know the difference of, oh, what does that look like? I do have a billboard. It's rather small. I see it when we start to get more of the shops. I have public transportation, so I would take carpool to San Francisco. I do work in San Francisco. I live in Oakland. And I also have McDonald's that's there, along with some other restaurants. Some are better than others, but I can pick up food and have it delivered. So living in that neighborhood, if I smoke and I don't exercise and I eat at McDonald's every day, yes, that is my choice. But I have the financial means to make different choices. And so that example, along with watching this, that click. It's not just what I do, it's what's available to us. So that worked. We had a new language, and this was key. I'll come back to this when we talk about the raising of America. So we talked about health disparities. There's a lot of research that uses the terminology and the language health disparities. And that started to move to health inequities. So the difference in health disparities is the data. It tells you we look at populations and we see differences. Health inequities, by using inequity, it says, actually, this is unjust and unfair. There is something here about the system. So those are the differences when we move from disparities to inequities. And then we move to health equity. And what do we have with health equity? We have something to fight for, something that gives us hope, something to work towards. And so while there are messages that say, either scare people, use fear, or use hope, hope re-inspired a lot of people also working in the field. This is what I can work toward, is health equity. So we had a public engagement campaign. We had more than 400 campaign partners, organizations that signed up while this series was still in production. Now, this didn't entirely happen on purpose. Some of it did, but then our production timeline went longer and people kept signing up. But that turned out to be a great benefit, which we actually have been intentional about with the Raising of America, because what it meant was that as people were hosting work-in-progress screenings, and they had to say this is a work in progress, and at the time we used DVDs, so we would send the DVD and we would actually handwrite with a marker. And we had the thought of, why don't you print it out and make it look nice? I was like, no, if it looks nice, people won't remember it's a work in progress. If it's my horrible handwriting, they will know. So what that did, though, is it invited people to be a part of the process. We are rarely invited to be a part of the process. Rarely do we share our unfinished work publicly. It produces anxiety for me. It continues to do so as we do it with the Raising of America. But it does build a sense of ownership, and everyone suddenly says that this is my movie too, and can give feedback, and that feedback has proven to be very helpful. There are some things that we thought, and earlier we heard you need to ask not just build your website for your colleagues, but for people out there, because we had some things that we were like, this is golden, and people over and over would say that doesn't work. We're like, what? Oh, okay, and so it was beneficial for us. Now, we had a lot of, and I won't go through some of these examples, but different ways of being able to use the series. The point here being is that people took it, they did trainings with it, they worked with local health departments to show the entire series, in some cases internally and with community, and that there were policy forums on Capitol Hill and state capitals. Now, we've been asked, how has Unnatural causes changed policy? And we are not comfortable saying, well, thanks to unnatural causes. We can't say that, but what we have heard is that there have been folks who've said, in one particular example, at Rhode Island, saying it was by showing unnatural causes and not the entire thing. You don't sit down some legislators and say, watch these 5 hours, good luck. But to say it was in part by showing that we were able to create a commission on health equity. And it is, again, coming back to this aha moment. So our lessons from the field, overall, we did do an evaluation afterwards, and what we heard was, what I'll summarize is get your house in order. In other words, there was the energy. People were ready, they wanted to do things. So we had health departments going out and organizing community screenings, and then community members saying, what do I do? What can I do? How do I get involved? And suddenly health departments going, we're not sure, whose email do you give out? Right? That's a real question. And as Dr. Tony Iton said to us, who at the time was the director of the Alameda Public Health Department, he said, we have funding streams to print out so many pamphlets, I can't tell you. But we don't yet have the funding streams to go out and actually be responsive to community members. And so and it's been great to see over the last number of years that those funding streams have shifted. So the way that the work is being done and thought of internally has had to shift, and that's been a real success, and not one that when we set out to make the Raising of America, because we're thinking PBS, public audience, that we were necessarily anticipating. Now, what did we miss? Well, what we missed is, and I wasn't here this morning, but I did hear in the audience that let's talk about children. Who's going to say I don't like children, right? Well, we got that. We said you missed a key population, which is looking at children. And so we came back and decided to do another documentary series called The Raising of America to really continue with unnatural causes in the sense of looking at inequities and health inequities, but doing so through the lens of the child. Now, we started by doing a needs ascertainment and asking folks in the field what would be most helpful. And what we heard over and over is that the field itself of early childhood is actually very siloed. So there's not enough money. There's a lot of silos. So to create something that would say this is an umbrella and to also rupture some of the dominant messages. And so this is what, and I'll talk about those messages we set out to do. Using the same format in the sense as with Unnatural Causes. There's a documentary series. This time, we're really wanting to say, how is it that we can provide all our kids a strong start? Because providing our kids a strong start actually links to having a nation that is healthier, that's more prosperous, and that's more equitable. So making that linkage. Again, creating it in the context of a public engagement campaign, here to really change the conversation, but again to say, what is it that we can and should do to make sure that all our kids have the opportunity for a strong start? Now, in this slide, I see the word opportunity is not there. Opportunity, and some say it's not the word that's the catchiest, but this speaks to we can't guarantee that all kids will have a strong start, because at the end of the day, parents can have everything that they need and still not have behaviors toward their kids that are great, right? And so it's about creating the opportunity. It's back to the neighborhood. If I have everything there and I don't do it right, then it really is about my own personal behavior and choice. But until I have everything there, you can't say it's just all about a parent and what a parent needs to do. And we have a companion website. So, what do we mean by changing the conversation? Well, we look at the conventional story, and it goes something like this. Babies don't remember, so it's okay. Don't worry about it. Until like they're 2 or they can talk, they're not going to remember. Whether a kid is successful or not really has everything to do with what kind of parenting they got. So it's about the parents and the kinds of choices they're going to make. Being a parent is hard work, so don't complain. Everybody knows it's hard work. You chose to do it. And that what can really help are parenting programs. Now, there is truth to all of these, but it is a lens that's about this big. So what we are trying to do is to widen the lens and to have what we're calling an emerging story that goes a little something like this. Yes, I don't remember when I was 3 months old, but my body does, my brain does. That in fact, our ages 0 to 3 are some of the most incredibly formative times where our brains are literally wiring together and our environment actually shapes the way our brains wire together. So that at the very basis, we're creating what some call foundation. I don't want to sound deterministic, but it's what we build upon, right? And so my daughter, who's 1.5 years, she might not remember, and the downside of doing this work is that I'm like 700 synapses a second, so there's a little there's something healthy about having some denial, which I don't have right now. But to then also say, well, we have to look at how growing inequities constrain or enhance what parents can do. Again, I don't live in a vacuum of just my house. There's what is around me and how does that help or hinder what I can do. And that we have a bootstrap ideology. You work hard, you can accomplish it all, and that can help us. But we're putting that onto whole families, saying you as a family need to do it all on your own. And we have to talk about that. We have to name that, because it's going, and I'll talk a little more about this, it's being internalized as oh, I do have to do it on my own. And that we can look at all policies being child development policies. So with health equity, we said all policies impact health. Well, the same can be said with child, because we're still talking about health. We're talking about the life course, and we're talking about how it is that the things around us either increase or decrease stress. And we now have the science that shows that when parents are stressed out, that stress drips down on their kids and actually alters their brain. Which is, it is scary to think about, right? As though parents needed one more thing to think about and worry about. So we have the documentary series trying to do this, and I'll start quickly with the supporting episodes. Here, DNA is not destiny. When we talk about the science, not a problem. It's telling you what you need to know in the science. As far as for us communicating, not very difficult. You have to find a way of telling the story, sure, but it grabs people's attention. Wounded Places, Confronting Childhood PTSD in America's Shell Shock Cities. Here we look at what happens to kids who grow up in concentrated poverty, see signs similar to PTSD, except there's no post. They're not being able to leave these neighborhoods. So here again, as far as communicating, and this is, when we send the work in progress cut around, people latch onto this one. And there's a way in which it's comfortable. We stay in the neighborhood. Yes, we don't talk directly about racism, but obviously racism is there. And there is something where at this point, most of the people who've seen this, if not all, are not people who they themselves have grown up in these conditions. So there's a way in which, and I'll come back to this, there's a safety there because it's still an other. Now, Once Upon a Time, and Are We Crazy About Our Kids? With Once Upon a Time, sometimes there's a little hot water there. People say, oh, you're telling the story about how we almost had quality, affordable child care for all, but it was vetoed at the 11th hour by then President Nixon. Now, the reason it was vetoed was a very political one, and we have Pat Buchanan on tape telling the whole story and saying, some people believe that it takes a community. We don't. We don't want government in our house, and I'm glad we did it, and we do it again. And who says that we took the opportunity to write a veto that would really direct the way we thought about families going forward. And so we see this great U-turn. Now, what's interesting is that when we tell this story, that there is an uncomfortableness about who might get upset about this story. And that's going to bring me back to when we talk about audiences. And Are We Crazy About Our Kids makes the economic argument. If you invest early in early care and education, it pays sevenfold down the line. It's kind of, your kids are not your soft, cuddly, wonderful, cute kids. It's like invest now and we'll benefit later. The opening show I leave for last, because that show we're trying to do three things. Talk about the science of early child development, place the parents in context, look at how we're stressed for time, money, and resources, and then talk about how policies can change this. And here's where we've come into some real difficulties, because we want to show this up and down the socioeconomic ladder. But when we go to the place of looking at middle-class families, we've gotten feedback. Well, that family reminds me of me. We shouldn't be focusing on that family. We need to focus on low-income families. So this has affected who our audience is and our messages. We talk about the choir. Oh, this is the choir. They're all with us. They're all with us. We need to convince the right. I've said, no, let's step back because of the example that I just gave. So if we separate, if there's an us versus them, then who really is our audience? I've put the choir in these sort of air quotes because I'm not actually sure that the choir is singing the same song or that the choir is actually in the same building. From the way we've done some pre-screenings and the conversations we've had, I've come up against a lot of internalized frames that actually very much need to be addressed. So the choir has become our primary audience, much to our surprise. It was not expected when we launched out on this project. We in America work more hours than most developed nations. We don't have a lot of time off. Taking a vacation is almost this sort of feeling you've got to apologize to take a vacation. And the good mother myth is alive and well. The good mother does it all. She's patient with her kids. She's there for her partner. She's showing up at work. She's putting in those extra hours. She's commuting. She's picking up. She's dropping off. She's bringing snacks. She is volunteering at the school, and she is enjoying every last minute of it. Yeah, we've bought into that. We have bought into that. It's become internalized. We know about internalized racism, right? Well, we need to talk about how these are internalized, because what so then happens is, are we working with or are we working for? Now, I've heard people in the field saying, this is what we need to do for low-income families. When I need to do something for a low-income family, I am separating myself from you. I do this for you. When I do something with a low-income family, I identify with you because you know what? We're in the same boat. Now, I have way more advantages. I have a lot more power. I have a lot more access. Me personally and kind of the collective I'm here today. But does that mean that I would not benefit from the same policies that would benefit a low-income family? Absolutely not. So, I got my knots confused there. The point being that I can afford my daughter's childcare, but if I only had to pay $200 a month for quality childcare, let me tell you, that would free up a lot of psychic space, a lot of emotional space. I can work from home 2 days a week and have a great job. I really like my job, and I commute into San Francisco. But if I could live and work in the same city, that would make a huge difference. If I had public transportation that really, truly didn't take longer than driving in, that would make a huge difference to my lifestyle, to my quality of life. So I come back to the choir because the choir might be saying we need to help low-income families, and I absolutely agree with that. But are we going to ask the families who are working 2 jobs, who don't have a stable income, who don't have a stable schedule, who live in dangerous neighborhoods, who are trying to take care of kids, who might be raising their kids on their own, which I am too as well, to say, you know, the other thing you really need to do is also be civically engaged. So if you could find the time, without the babysitting and without the food, to really get out there and advocate for what you need, that'd be great. So I come back to the choir because I realize who has that time. Now, we are all stressed for time, but who has more power to be able to change what you do with your time? We do. We do in this room. So that it starts to, and this has been a very interesting personal journey for me of having a child working on this project, but being able to say, how do I come in and say, I need to reduce my work hours? And then really do it. How do I stop checking my email at night after she's gone to bed and actually maybe, I don't know, read a book? So it's that place of how do we look at ourselves and start to bring our whole selves to this work? What's been very interesting about this project is how it leads to values, and I'm getting ahead of myself a little bit. So dormant allies, these are our second target audiences, and I've left the opposition there, but that's not really actually an audience for us anymore. Dormant allies are the people who are with us, but they just haven't talked about this or thought about it. So it might be that they're working in a different field, and it's saying, you know, we look at affordable raising the minimum wage. We're not seeing stories that say if we raise the minimum wage, that would be great for kids. That's a way of messaging, right? We can do that. So it might be that helping others in other sectors use the lens of the child to advance health equity, and coming back and saying, you know, if kids are doing better, this is better for you. It means that we have less violence. It means that we have safer communities. It means that we're all doing better. So that's the personal investment. Now the opposition, and I say let us act rather than react, with an example, 2 things. One is that if we are reacting, then there's, and I've gotten this, people are going to use the science in your movie to say that we should take kids out of their homes if there's spousal abuse and put them in foster care. What are we going to say to that? They're going to use the science. And I say, well, all right, we follow the science. Going into our foster care system is actually not reducing stress for kids, right? So what we have is a situation where we don't have the right answer. The conversation needs to be around how do we take a child out of a situation but put him in one where we're not creating additional stress. So how do you shape the story? And then we have the other piece on the opposition is to give, let's put it this way, there isn't a movie that the right could make that I would watch that would suddenly change my mind. So let us have some respect as well for others as fellow humans having different opinions, and also to honor the medium that this is not the series that will be able to change the minds of the right, and that is not where we are, and I don't believe that that's where we're ready. Where we need to be is really changing the choir. So this said, and I will, I'm almost there. All right, so to say that for a public engagement campaign, what we're now moving towards is really this feeling of tapping into our full potential as a nation, that we want to move away from anxiety and fear of not having enough, which studies have been showing to find not just in the low-income class, but in middle class, and even the 1%. There's a fear, I'm not going to have enough, I'm not going to have enough, that's waging through our culture, our society. And really, there's a place of self-blame and shame. John Powell says, we've made public problems private problems. So that means that when I can't get home in time to get my kid out of daycare, that's my fault. If I can't afford the daycare I want to send her to, that's my fault. If I can't take as much time to be with my kid after she's born, that's my fault. I have to deal with it. Rather than saying, how can we create a society where I have more choices? That is not, I meet a lot of moms at the park. That is not the conversation they're having. They're trying to do it all themselves, but not looking at this country and saying, how could we do it differently here? So we've gone from looking at health equity to looking at health equity through the lens of the child to coming to this conversation of values. And by values, what we've really started to look at is, does wealth equal happiness? That is one of the American values, but actually saying, no, wealth versus happiness. We need money to survive. Yes, we need money to live and we need money to thrive, but money will not make us happy. What will make us happy, most likely, I'll speak for myself, is more time with my kid. What will make me happy is not spending that much time commuting. What will also make me happy is having a neighborhood that's completely safe, both up the hill and down the hill. I live in Oakland. Up the hill, very safe. Down the hill, flats, not so safe. What will make me happy is to have more choice and empowerment and to go to work and end work feeling like I have accomplished something rather than I have so many more emails that I can't get to. So managing the kind of hours we run. France passed a law saying you cannot check your email after hours. Yeah, we laugh, but can you imagine? All these countries who are working less than us, are they happier? In some ways, yes. So looking at this place of coming to happiness. So all that said, we engage people. We want them to use the documentary rather than watch it. We have a companion website to help. As we're doing this thinking, we're translating it into some of the writing because we're discovering creating this film is a research project that none of us anticipated, that has come into our lives in ways we didn't anticipate. And that ultimately we can say it's easier to build strong children than repair broken men. And then I leave you with this question of what brings you happiness? How do you bring your whole self? How do we take our own responsibilities for where we are now to imagine a better place for ourselves, for our children, for our grandchildren, for our friends in our own communities, and in doing that, then hold arm in arm with those who are not in the same income bracket as all of us. It's a high charge. This is what we're trying to do with the Raising of America, and this is what we're learning, all of us at California Newsreel and at Vital Pictures, on this journey of creating this documentary, which has become much bigger than any of us ever anticipated being. And so join us in early next year, with a finished product that we hope will come close to achieving what we're learning in the process. Thank you all so much for your time. I've got to run.